So as of today, we had 518 additional new cases of COVID-19 identified in British Columbia, bringing our total number of people diagnosed with COVID-19 to 48,027, 97 of whom were in the Vancouver Coastal Health Region, 332 in the Fraser Health Region, 9 people in Vancouver Island, 49 people in Interior Health, 31 people in Northern Health Region. We now have 9,137 active cases across the province, 348 of whom are in hospital, 80 of those in critical care or ICU. We have about 9,689 people under active public health monitoring, although that does not include active monitoring in the north at the moment. As we mentioned on Monday, we're doing a data transition and we'll have more detailed information to catch up on next week. 36,952 people have recovered from COVID-19. Sadly, once again, we have far too many people who have died. We had 19 new deaths from COVID-19 in the past day, bringing the total number of people in our province to 796 who have died from COVID-19. Over the past day, families, our care providers, and communities have lost loved ones. Most of them are grandparents, our parents, aunties, sisters, and brothers. Many of them in long-term care, and a number in our acute care hospitals. We send our condolences to all of the families who are affected at this time of year, and we mourn with you and we feel your loss. We have 2 new healthcare outbreaks as well at the Evergreen Baptist Care Centre and Minaroo Residence, and 2 which are now over, including a large outbreak at the Felburn Care Centre. And we know how challenging that outbreak has been, and we want to do everything we can to make sure that never happens again, as well as the Villa Caratal. That leaves us again with 55 active outbreaks, 6 in acute care, in long-term care and assisted living, and 6 in acute care, affecting 1,414 residents to date. On a more positive note to date, as of yesterday, we have 5,603 people across British Columbia in every health region now who have received a COVID-19 vaccine, and myself included. Had the privilege of being with my colleagues and friends and the amazing public health team at Vancouver Island Health yesterday to show my support and my confidence in this vaccine across the province. And as I mentioned, we have another encouraging step forward in the Moderna vaccine being approved for use today. In the last month, as you know, our focus has been to encourage everyone in the province to reduce your in-person social interactions, and no more so than now as we head into these holiday weekends. The orders that we have in place support these efforts, and we are closely monitoring their progress, and I particularly want to draw people's attention to the order requirements for retail and vending markets, which has been adjusted to ensure that over the coming weekend, and Boxing Day is a day that I know many retailers have expect to have people coming in larger numbers than maybe in normal. I encourage people to stay local. Go and visit your local retailers and go in small numbers. But I also remind retailers of the need to ensure capacity limits meet the requirements of the orders, that one-way paths are followed, that barriers and mask requirements are being followed. If you are someone who cannot wear a mask, then phone ahead. Consider other ways of shopping on those days if you need to. And I will say that WorkSafe BC will be monitoring these activities over this holiday weekend. Additionally, as I've mentioned a number of times, we've had challenges in the north, and some of those challenges have been related to outbreaks that we've reported on in a number of the industrial work camps that are in the Northern Health Region. We have been working with those large industrial camps and the employees that travel frequently to and from those camps, and as of today, I will be putting in a new order in place for industrial work camps in BC. And this order will require work camps to do a phased, slower startup in January. The original intention and the nature of these industrial work camps means that employees are frequently traveling to and from these work camps. And we know at the start of the year, the camps typically see an influx of employees returning to the site from BC, from around BC, but also from other places outside the province. This large movement of people means a much higher potential for spread, both amongst employees, but also into communities along the areas where the industrial camps are in the north. And right now, we know that Northern Health is stretched, both from a public health perspective, trying to manage and support communities where we have transmission, but also our health system, where there are a number of people both in hospital and ICU in the north. We are already seeing many small, rural, and remote communities in the north under strain, and the order that I will be giving will help to ease that pressure at the start of the year and ensure that our health system will be able to maintain the services that we need for everybody along the north. We have been in discussions with the major industrial projects now on how to make that happen, but that will happen so that we are not putting our communities at risk in January. As we know, the modeling has shown that the measures we are taking are work. I know the restrictions and the orders are difficult. But we also know that we have learned how to deal with this virus. And we have learned that when we take those measures, when we don't have gatherings, when we wash our hands, when we cover our mouth, when we wear our masks, when we stay home when we're ill, when we work from home now as much as possible, and when we are careful about following our COVID safety plans in all settings, we know we can reduce and stop transmission of this virus. With Christmas 2 days away, I remind everyone to keep your celebrations small, to avoid travel to other communities. Stay local, stay small. Show you care by staying apart and connecting with people in safe ways. We want our family, our loved ones to be there for the next celebration, for the holiday that we're going to have when we get this pandemic under control. The fewer people we see now, the safer we will all be. We need to show we care by staying physically apart and connecting virtually. This is a special time of year, I know, and having those connections with people we love and care for is important. So I encourage all of you to remind yourselves that we are in a very important place right now where we have vaccine and where we know the measures that we need to do to get us through this period together. You are a COVID-19 prevention expert. All of us are. And we know we can make it through this. We've come this far. Let's finish this year and start 2021 in the best possible place we can be. Following all of our orders, using your layers of protection, and staying close to home with those you live with. Allow us to do that. So together, let's make this a safe and happy holiday for all of us. And I want to again thank everybody for being part of this team that has got us this far, and to encourage you to remain strong and to remain kind and calm and be safe.